Good afternoon, welcome to Schein Chats, where we're bringing Team Schein members together with industry leaders. Today we're broadcasting live from the Greater New York meeting. My name's John Cox. Joining me this afternoon is Rune Fisker from 3Shape, where we're going to continue the discussion on how we're working in partnership to help move and accelerate the adoption of digital dentistry into dental practices throughout the world. So Rune, maybe we start with share a little bit about who 3Shape is. What's the company?
Sure.
Where did it all originate from?
Yeah, it actually started in Copenhagen 16 years ago. So Thijs Clausen and Nikolaj Dijkman founded the company.
Okay.
And I actually joined in the garage as the first employee.
So you're the garage employee?
Yeah, the garage employee, yeah. And it's been quite a ride. We started out doing digital hearing aids, completely revolutionizing this industry. Then we move into the dental lab, where we are number one globally.
Now just hearing aids, just one question.
Yeah.
Is the number of the hearing aids that are manufactured today, an extraordinary percentage is done with your 3Shape software?
Yeah, it's like more than 80% of all hearing aids are done with that. And one thing is also really exciting about the hearing aid is actually back in 2001, we were 3D printing hearing aids.
Wow.
So we were the first company really to do mass customization on 3D printing technology. You know, 3D printing is so hyped today.
Right.
But in 2001, no one has really heard about it.
That's exciting. So you're ready for it.
We are ready for it. We have been waiting for 15 years on this 3D printing, getting really ready for dental also.
Okay.
So, and it's coming now. Then we moved into the lab, where we are globally number one. So we have thousands of lab scanners here in the US,
right,
which are really strong basis for also digitalizing the dental office.
Okay.
And then 5 years ago, we launched our Trios, our intraoral scanner,
right,
which is really extremely well received with the market. It's been growing extremely fast, and even more important, case adoption is up several 100% here in the US. And you can see the Trios here in the background. And scanning intraorally into the mouth, and then. Lately, we've introduced a number of apps to the Trios, which you can really expand the use of the Trios into, implants, ortho, and so on.
So let's talk about the show. What anything new that you're seeing? What do you bring to the show that's new?
Yeah, I think the by far most exciting thing, and really one of my old dreams, is the integration, to Dentrix, or the practice management system.
Right.
Practice management systems and intraoral scanning have always been separate. We've never been, combined together. And now finally, we have a really deep integration with Dentrix, where we can get the scan back onto the patient chart. Okay. So you don't have to re-enter, first of all, you don't have to re-enter the information, but more importantly, you also bring it back on the the chart.
So the accessibility, easy to access, you know where it is, sits with the patient chart. Completely
integrated into your normal system, so your patient management system, your Dentrix. And next time, half a year later, you can open it up and you can completely see the full intraoral scan. You can even see how you're prepped. Right. And you can do that on any computer in the clinic. So I really think that brings digital technology into the mainstream.
Sure.
Of the practice.
So in the integration within Dentrix, it's also, they have the ability, and maybe expand on it, the ability to send that file to a laboratory, and it actually works within the scheduling software within Dentrix as well. Correct, so again, it's taking one job away, automating it, and saving time. And today, let's face it, everything is about more efficiency within the practice. So that's probably a big deal, right?
No, that's exactly what we hear from the beta testers so far, that they have really liked that integration. Also the documentation part of it.
Right.
We have documented the cases, And it's just so much more accessible. I mean, you don't have to no one go and search on a card or on an intraoral scanner system half a year later to find a case.
Sure.
You have everything in your normal, and highly efficient in your normal workflow.
So fair to say that a lot of equipment has been purchased to do the job. Now, 3Shape seems to be bringing it all to clinical workflow. It's all integrated digital clinical workflow. Exactly. You mentioned an application, Implant Studio.
Sure.
Maybe share a little bit on how that's changing the way that implant dentistry is being delivered digitally.
Yeah, what's really changing with Implant Studio is it becomes so much more accessible and so much easier to do planning and improve the patient experience. Because with guides, there's a much better patient experience. You can do a tissue punch, and also efficiency-wise, I mean, you save chair time, save a lot of chair time. I mean, and it's as one of our good KOLs is saying, it's as easy as cleaning teeth, placing implants with a guide. So I really think that guides can also, drive out of implant planning, can also drive adoption and make people grow their business, grow their clinic by easily adopting. You
say that time is a big deal, and dentists today are looking for more efficiencies. When we, At Henry Schein, our whole integrated workflow solution is all about three. We talk about three things. One is improving the patient experience.
Exactly.
And I know when a patient sits in the chair and they see the scan and they see their teeth larger than life, it really does have an impact on the patient.
Sure.
And it helps educate and it helps increase case acceptance, no question. So the patient experience. Two is the improving the predictability and consistency of the quality of care.
Exactly.
Where things are done in a better fashion.
Yeah.
One example, working with the labs. The research shows that reduced remakes, reduced adjustment time when they send a digital file versus a traditional polyvinyl case. And then the third piece that we like to focus on is improving the efficiency and productivity in practice. 3Shape has really taken those three pillars that we refer to and really exploded on the scene with delivering on all three.
Glad to hear that.
I mean, it's fabulous,
yeah,
fabulous. So another big recent announcement obviously has been the Invisalign announcement.
Yeah.
The integrated solution with Invisalign and the ortho. Maybe share a little bit of that and where that's going.
It's really been exciting now, giving our officers the opportunity to submit to Invisalign. And I'm glad to say that we announced also on this show that now there's free availability. So there's general availability for the Invisalign connection. Okay. And we see many hundred dentists already signed up, of our existing users already signed up for the Invisalign connection.
Okay, so the initial placement was just a smaller group of dentists to perfect the workflow,
exactly.
and now it's open to everybody.
Exactly.
So any 3Shape Trio scanner customer can now go online, go through the process, register to be sending cases to Invisalign and turn it on.
Exactly. This is quite small training effort. You need to watch a video,
okay,
and then you get signed up for Invisalign and you can directly submit your cases. Okay. And I actually think aligners is a great opportunity to also grow your practice and grow your profit and revenue stream into this. And Trios is an excellent tool for that.
Right, fantastic. So let's talk about where do we go from here? What's next? What's next for? I mean, you guys have ridden the technology wave. It's been exciting with what you brought to dentistry, and we're glad to be riding along with you. What's next? What do you see?
There's a lot of things coming next. We are only still at the start with intraoral scanning. I really truly believe we are at a tipping point right now, where the technology gets so good and so accessible, and you can do so many things with it that many clinics will buy over and adapt over the next years. But you can say one of the things we are most excited about is what we call detailed patient monitoring. So this is, that you have a scan from maybe 1 year ago, you have one for half a year ago, and the patient walks into a clinic again, and you scan them, and you basically compare that scan with the previous visits into the clinic. And we have and this way, instead of just looking into the mouth of the patient, you actually can now measure whatever changes there have been. So we really have a scientific, way of quantifying what changes there have been, whether your bruxism, gingival retraction. You can see if your teeth movements are going as you planned. If you do an auto treatment, you can see we have some really nice clinical cases where we see how the gingiva is healing perfectly based on implant treatments. And I really think it's redefining the way we use intraoral scanners, because today intraoral scanners is just a treatment tool, right? Where here we go to diagnose, and I think it's a rare chance to make it a better world, because we can catch, diseases, problems with the teeth earlier and treat them earlier.
It's fantastic. So let me see if I've got that right. If I'm a practitioner, I scan every patient.
Yeah.
I start to build my case records. A year from now, 2 years from now, I have a scan and it automatically shows me if I've got 1 millimeter tooth wear on that posterior cusp, which I wouldn't see otherwise.
Exactly.
Now I can communicate with the patient, educate the patient. It might be a night guard appliance, it might be a bruxing appliance.
Exactly.
Which prior to that I wouldn't have that. Tissue recession, the same thing. I can see minor tissue recession over time, slow down the aging process, accelerate the hygiene treatment.
Exactly.
So from a diagnostic tool but to a patient information education process, I think it's going to be very powerful. I think it's fabulous, it's exciting. We really appreciate you taking the time, share some of the innovation with us at this meeting, and we look forward to what 3Shape and you and your colleagues are going to bring to the forefront to continue to accelerate digital dentistry. You've made a huge impact, and we look forward to seeing where we go with it. So I really appreciate taking time today.
Thank you, and thank you for helping us.
Pleasure.
Thank you.
And thank you for joining us on Schein Chats. We hope you'll stay tuned and join us for the next segment that will be coming up later on this afternoon. Thank you.